Hello and welcome to Advanced Rheumatology's Catching Up on the Couch. I am Christine Matelan, Head of Operations, and today I have the pleasure of being joined by Dr. Angela Stupi, Matriarch of the practice. And today we're going to discuss COVID-19 12 months post-quarantine. So,
Good morning.
Dr. Stupi, what are your feelings after 15 months since the beginning of the pandemic?
Well, I think we've done a fairly good job as far as vaccine availability now. It's just a matter of the patients proceeding with their vaccines. We've been able to lessen the death rate and the infection rate significantly with the vaccines. And it is extremely important to impress on the population that the vaccines will protect them from severe disease and death. You know, before we were seeing 1,000 patients dying daily in the United States, and we've had 600,000 deaths in the United States. And now we are seeing still 200 to 400 daily deaths in the United States, and they appear to be where the states have the least vaccination rate. And when they take a look at the deaths of those with COVID, 99% of those patients did not receive a vaccine.
And for our audience, our entire staff and physicians are all vaccinated. And Dr. Stupi proudly wears her COVID-19 vaccination bracelet, and we continue to wear a mask in the office and ask that our patients do the same, whether or not they are vaccinated or not. So you explained the importance about the vaccine and its effectiveness on the population. What about on our immunosuppressive patient population?
Well, we have a special population of patients in that they are on immunosuppressive drugs. And in fact, those drugs will prevent partially a full, they will not have a full response to the vaccine, but they will have a good response, a good and modest response. So we definitely encourage our patients to receive the vaccine and as soon as possible. But we have to give the vaccine in timing with their medication. Now, if they are on IV infusions or injections, they have to be cognizant that they should call the office and say, how do I get the vaccine in relationship to the last dose of my medication? And we have found that patients do not respond fully because of those medications. The Rituxan, which is a B-cell depleter, which is rituximab, and ocrelizumab, those two are probably the toughest as far as being able to manifest a vaccine response. And so we have to give the patient specific directions as to when they should receive that, the timing. But also steroids are probably the second most reason for the patients not having a full response to the vaccine. And we attempt to get them on the lowest possible dose of steroids or avoid having to take steroids around administration of the vaccine. And so it's very important that we are in touch with them and they are in touch with us when it comes to questioning that.
Okay. So the death rate does continue as you stated. And you commented on the vaccines being, widely available. 155 million Americans have been fully vaccinated. In Pennsylvania, 6.37 million have been fully vaccinated, which calculates out to about 49.7%. Do you feel this is an acceptable number?
No, I don't. I feel that we have to try to achieve what they were encouraging 70% vaccination rate if possible. And that will confer the herd immunity that will then protect other patients. And so vaccination is not only important for the adults. It did come out, in the beginning for adults, but now we have vaccination available for teenagers who are ages 12 through 18, and I strongly encourage administration. They do not cause infertility. They do not contain microchips. They do not alter our DNA. As a matter of fact, the mRNA vaccines, Moderna and Pfizer, are really in our system for only 1 to 3 days, and they're then biodegraded. So it's not like it's hanging around and altering our DNA. It doesn't penetrate the nucleus of the cells where the DNA is. And the J&J vaccine is in the system probably for about a week. It has a slightly different mechanism. It's not the M spike protein. And it does confer excellent immunity. As a matter of fact, they think it may have somewhat better immunity because it's in the system a little bit longer.
Now, I know there's not any data out on this, and in the foreseeable future, do you feel that colleges, college students have to have their meningitis vaccine before they can get on campus? Do you think that someday it's going to be mandatory even in elementary schools?
I think in the beginning, I think definitely so that we can eradicate. I mean, we're seeing substantial deaths with this. So we would like to, we'll never ever get it to ground zero, to COVID zero. But the only thing that we've ever been able to achieve to completely eradicate on this earth is smallpox. But that won't happen like this, like flu hasn't happened. But we can certainly get to a low infection rate. And I think that college students, they congregate, they're together. I think it's really important for them to be vaccinated.
Right. And I guess one of the fears or rumors is if I get the vaccine, I might get COVID.
No, that's not true.
Okay.
That's not true. People do not get COVID from the vaccine. They're just having an mRNA particle that allows the body to respond with antibodies against that, and that is biodegraded by the body within 3 days.
Okay, so right now we're in the midst of summer. Most retailers and restaurants have it on your honor policy. If you've been vaccinated, you don't have to wear a mask. If you haven't, they suggest that you do. You're out and about during the day. I'm out and about during the day, grocery shopping, whatever it may be. I very rarely see patients wearing a mask. How do you feel about that?
Well, I hope that if they have not been vaccinated, they would wear a mask. I think it's very important for their safety. I have likewise seen that many times. If I'm going into a public place, I will go in with the mask and continue to wear the mask until I see really what the policy has been within that public place. The summertime has been good because we're outdoors and we don't have to worry about being indoors in close exposure to other people. So that has allowed us to relax on our use of the mask. And the CDC does say that if you've had both vaccines or have been fully vaccinated, you probably do not need to wear a mask if the other person you're with also has been vaccinated.
Now, in Western Pennsylvania, we have all the changing of the seasons. Come mid-September, late September, we're going to get into the rain and the cold, and then we're going to be indoors.
And depending on what's happening with this Delta variant, we may be forced to mask again indoors and within close quarters of other people, or when we are near other people. The Delta variant has really caused a resurgence of COVID now. Now, if you've had the vaccine, you're pretty well protected against the Delta variant. But just this morning, I heard that the booster has been developed by Pfizer, the third vaccine, that will definitely confer protection against the Delta variant. So I think we need to think about the boosters in those of us who have already been vaccinated as we approach the winter months and having to be indoors.
Now, obviously, Pfizer has developed a booster. That would be for the patients that received the Pfizer vaccine.
No, my understanding is you can cross over.
Okay.
If you've had Moderna, you could still get that booster vaccine. That is my understanding, and I probably need to double check that.
Okay. In your medical expertise, do you feel that the boosters are going to become like our yearly flu shot?
That's kind of how I'm leaning. Yes, like we always get another flu shot on an annual basis, and it's because they modify it. They take a look at what the flu types that are going to be most prevalent. I think that's what the boosters will be like, probably with the COVID vaccines.
Okay. Of our population of patients that did contract COVID, are you seeing long-term side effects such as fatigue, body aches, shortness of breath, anxiety, GI complaints, or what's known as brain fog?
These have been termed the long haulers of COVID-19. And yes, we are seeing that. We are seeing that at 60 days, 10 to 20% of the patients who had COVID will be continuing with some of these symptoms. And the long haulers are basically those patients who continue with these symptoms 6 months or more. And let me also comment that death has occurred at 6 months in these long haulers too. So that probably has not been included, and it's due to COVID-19, and that hasn't been included in the death rates that we were talking about.
So these patients with these symptoms, they should not hesitate to see a specialist if they're having shortness of breath, like a cardiologist.
No, it's very important that they have their symptoms evaluated. Now, the most common symptoms are fatigue and weakness. And we see some musculoskeletal symptoms, and the brain fog is a prevalent symptom, the shortness of breath. And so I know that at the Cleveland Clinic, they've set up a clinic where they take a multidisciplinary look at these patients, and there are funds now, $1.5 million or $1 billion that have been provided to assist these patients with their symptoms to classify them. So if they're having cardiopulmonary symptoms, they're having a chest x-ray and an EKG and an echocardiogram and a 6-minute walk test. That's where you will walk for 6 minutes and see if your oxygenation drops. And if they're having the brain fog, we need to have them assessed by neurology. And of course, for the musculoskeletal symptoms, the rheumatologists are seeing them. Let me also say that sometimes patients may have had an underlying autoimmune condition that really hadn't manifested. And with COVID, it has become manifested. So we may be seeing more autoimmune conditions that were lying dormant in some patients.
Okay. Now, there's some publications, medical publications, obviously, that we've read where we're having a surge in opioid epidemic again.
Oh, this is very important. We were really in a severe opioid epidemic, and then around 2012 there was a lot more awareness brought about, and the opioid use had really dropped maybe by the prescription rate and everything by about 50%. And now we're seeing a resurgence of opioids being prescribed, and it's in the long haulers. Now, what happens is many times when they're hospitalized or on a ventilator, there's stress and whatever, and they're put on pain medication and benzodiazepines like Xanax or Valium, and And so they're written prescriptions at the time of their discharge to continue use of this. I mean, it's meant for them to taper off, but sometimes it doesn't happen. And so they continue to get hooked, addicted to these medications, unfortunately, and become drug seeking. There have been 88,000 opioid overdose deaths because of this. And some patients find it that if their doctors won't prescribe it, they then drug seek and get heroin. And heroin by the dealers is laced with fentanyl, and that's what causes, and we just don't know, and that we have the deaths. And so we have to really be careful about the patients and continued prescription of opioids.
So full evaluation,
Yes,
and constant monitoring
Yes.
of the need for the refill.
Right.
Is it absolutely warranted?
Right.
So in our practice, we treat many debilitating immunologic diseases with drugs that may impair the immune system. Has the American College of Rheumatology updated any guidance?
Oh, they've been fantastic. By February, we already had guidelines being established as to when we administer the vaccine. First and foremost, patients who are immunosuppressed do need to be vaccinated, because they are at higher risk of developing COVID and can be in the group of the long haulers. Women, age greater than 65, they are the population that may be subject to becoming, they're the ones that are identified more so as being long haulers. But what was your question again?
If the ACR had...
The ACR did come out. They did come out with the drug treatment. And so we were told that the patients who were on the anti-TNF drugs, that we, if they get the vaccine, you have to hold it a week later. And similarly for some of the oral medications like what we call the JAK inhibitors and methotrexate, we would, yes, even Cellcept. A lot of the anti-transplant drugs, they are really an issue. And so if they can be held a week following the vaccine, that gives your body a chance to respond to the vaccine better. So.
Okay, so final question. Do you feel there'll be a resurgence? And what about these members of society that just kind of feel, the more people that get vaccinated, I don't have to, because the more that are vaccinated, the less chance that I have to catch it?
If you are a healthy individual, yes, you should be vaccinated. If you are an autoimmune, or if you have certain medical conditions that make you more likely to develop severe COVID, yes, you should be vaccinated. There are some people who have allergies or have had reactions to vaccines, and those are the patients that we have told to not go ahead and be vaccinated, and that's why we want the herd immunity, so that they're protected. So there are some people that can't take vaccines because it has precipitated other conditions with them, or they have severe allergic reactions, and so those are the patients that we will, but it's important as we approach the winter that the vaccination rate goes up.
The vaccination rate goes up, masking, distancing.
Yes. We want to still continue. We will probably have to, especially if we have the Delta variant emerge significantly, we will probably have to start social distancing, masking, hand washing should always be in place.
And obviously at the annual American College of Rheumatology meeting that's held basically every November,
right,
there will probably be a vast amount of information coming out.
We have learned a lot. The COVID patients who have been hospitalized, they've stored some of their blood specimens so that they can go back and take a look at this or that. And I think that, a lot will emerge over.
There'll be a lot of abstracts on things like that. So a lot of basic science.
Yes, and further recommendations, and we don't know how long the vaccines last.
Right.
We don't know how long they confer immunity, but things like that may be answered as time goes on, and that's why we suggest then the boostering too.
Right. And obviously the country wants to get back to normal. We're slowly trying to get back to normal, but we do have to use the precautions that you said. If you have an autoimmune disease, whether you're treated here or somewhere else, please, please, please be vaccinated, and please check with your provider about if you're on medications of when to get those vaccines. We were both vaccinated. We actually have you being filmed getting your first shot. Basically, all of our staff of 23 had really no problems other than a little bit of arm pain from the shot.
Yeah, we were very fortunate, and
we have an array of ages that work here.
And
so
it was. I personally, I had maybe a little bit of itching the first time. And on the second vaccine, I had some fatigue, and I'm glad I got it on Saturday, because Sunday I had to take it easy, and that was it.
Okay. And then, once again, thank you so much for joining us for a session of Catching Up on the Couch. Dr. Stupi and I look forward to seeing you in the office. We're going to do these on a regular basis because they seem to be very well received. And once again, thank you, stay safe, and get vaccinated.